Ladies and gentlemen, thank you again for joining us. We'll of course, continue having these briefings indefinitely to keep the citizens of South Carolina and everyone interested and concerned fully informed. I have issued a new executive order today. One closes non-essential businesses in our state. We issued one last week that did that on some non-essential businesses, and now we've issued another to expand that. And this includes, this is starting Monday at 5 p.m., furniture stores, jewelry stores, department stores, clothing stores, shoe stores, clothing and shoe accessory stores, florists, sporting goods stores, book, craft, and music stores, luggage and leather goods stores, and home furnishing stores. Such things as hardware stores, these are not included. Hardware stores, firearm retailers, and home improvement stores are not included in this order, and all that will be made clear in the written order when it will be issued. But again, that will go into effect Monday evening at 5 o'clock p.m. Also, I have issued another order that goes into effect right now, and that is about short-term rentals in our state. I'm hereby suspending short-term rentals to persons from CDC, that's the Centers for Disease Control, identified places, hotspots, states, from coming into the state beginning right now, rentals starting right now, no new rentals of those places starting right now indefinitely. And that includes hotels, short-term rentals, motels, vacation homes, condominiums, resorts, bed and breakfast companies, timeshare companies, but this specifically excludes people from any place that are military, medical, first responders, or commercial transport people. So those are the two executive orders. Those are new. As you know, we are taking a deliberate, steady, planned approach. We believe this is the best way. It's based on the science, based on the facts, based on the advice of the professionals, and we will go as far as we need to or as advised to keep the people of this state safe. And with that, Dr. Bell.
Thank you, Governor, and good afternoon. We have now received reports of documented cases of COVID-19 in every county across our state. This includes 147 new cases as of today, which brings the total number of people confirmed to have COVID-19 in South Carolina to 1,700 cases. We are at the point where we are reminded daily of how serious this situation is and the obligation we all have to help prevent the loss of additional South Carolinians. Know that we are all in this together, and at some point many of us will likely be exposed to the virus. And the level in which the virus continues to spread will rely on all of our actions. We want to reassure the public that so many of us are working hard together as a team from the local to the state level and with national partners to protect the health and safety of all South Carolinians. As of today, we continue to work with healthcare facilities to stay updated on the availability of acute care beds throughout our state, and currently we are at 52% capacity. We are working with our emergency responders on an electronic system that will allow them to determine if they are responding to a house where there has been a recent COVID-19 patient. This will give our first responders additional information to protect themselves appropriately. And we have provided a third round of PPE shipments to the counties from the Strategic National Stockpile. We know that this is a challenging time, and what we're calling on everyone to do is not easy. We encourage all South Carolinians to take actions to protect themselves and those they love. Nearly every day we learn of a new case that is the result of an unexpected exposure or an unknown source. And what our current data shows is that social distancing and staying home helps combat the spread of this disease and ultimately saves lives. And so this must absolutely continue everywhere until we see a significant decline in these cases that is sustained. We are always mindful that each new case represents a real person. We anticipate releasing counts of confirmed and estimated COVID-19 cases by zip code later tonight. We will provide estimated cases at a later time, but those will represent those who are likely undiagnosed or untested. And by including estimates, we hope to better convey more meaningful information about the real risk of disease spread in our communities. We ask for your continued cooperation with following the guidance of public health professionals so that we can continue to fight on every individual's behalf. I ask everyone to please do your part, to stay home and limit your close contact with others so that we can slow the spread of COVID-19 infections.